And it's such a blessing, and it's a blessing for our entire team to be able to do this every day, because we know if we work really hard today, that some life somewhere around the world is being impacted greatly. For well over 30 years, we've had project teams going to all areas of the world, hoping and seeking to serve the less fortunate. MMI really started as an idea out of the Dominican Republic. There were some missionaries that started to focus on healthcare concerns, and slowly but surely started to branch out the concept of bringing teams to focus on the healthcare needs of others. Medical Ministry International has now evolved into this worldwide organization that utilizes volunteers to make a dramatic impact on people that basically would not survive without them.
This city is in the middle of the jungle. There are no roads to be able to connect this city to the rest of the country. So they are isolated.
And so then here there's no obstetricians, no maternal clinic, no... So it's only a clinic here, no hospital anywhere near.
Tenemos que decir que
¿Murió el niño?
Sí, murió. Ayer aquí en el centro de salud.
A child died here in their healthcare center yesterday, 12 hours coming down the river, and then at that time the baby died.
Lives are lost. Lives are in danger all the time, much more than we ever realize.
And that's probably the thing that motivates all of us the most. We see people that have really come to a point that they're truly at death's edge. You have people that are hours and sometimes days away from being able to be served. And so those are the type of areas that MMI looks for. MMI focuses on project teams as well as health centers and residency training programs that are based throughout the world. Currently on our calendar, we have over 90 project teams scheduled for this year alone. We have staff on the ground in every one of the countries that we serve that go out and really assess the type of team that is needed. When that team arrives, we hit the ground running. Our goal is to just wear this team out, so when they leave, they're physically exhausted, but they've done exactly what they've come to do.
As a leader in a project like this, with this size or any size, is flexibility. We touch these folks compassionately.
There was a young boy came today with his father, and they had come from Brazil 15 hours upriver apparently, and the young boy has an infection behind his eye. He has not been able to find service in his home country. When the father brought the young boy to the registration desk, he said, "My boy needs treatment, I don't have any money, I have a watch. Could I trade the watch for help for my son?" Well, we can help his son, but he keeps his watch.
Since it started 10 years ago here in Colombia, we have seen more than 50,000 patients. We have done more than 4,000 surgeries. There is no organization here in Colombia that has done that.
The difference between MMI and our projects than other projects is that we're trying to empower people both to change their lives, understanding Jesus, but more importantly, giving them the opportunity to continue to extend in their community services. So that's why these permanent centers are so important.
I began to work here in the Amazon. I prayed to God for a clinic 12 years ago because I saw the need of the people. When I heard about MMI want to come to take Clinica Leticia, that touched deeply my heart.
Consider the fact that a child can fall down and scrape their knee. In the areas that we serve, that child can develop an infection almost overnight and have the potential to actually lose their life. If these clinics can provide a tetanus shot, you can extend the potential of life dramatically. We bring the resources so that not only our teams, but our in-country staff and our health centers have the right equipment to diagnose the illnesses that we face for people that normally would not have access to it.
We don't go anywhere that we're not invited. That's always been part of our DNA, is that we always go somewhere where people want us to be here and to partner with them.
Anytime you operate a facility such as Clinica Leticia, you have nurses and doctors that are very focused on helping those that they're serving. The challenge that you have, though, is that they need to continue to increase their skill set and their knowledge base as new processes and procedures come forth. And we bring in specialists and trainers to work side by side with these groups. And it's an all-inclusive focus on training. So as we train the doctor and raise the doctor's skill set, we too have to raise the skill set of the administrative team.
Hemos visto que hay un ánimo, o sea, un ánimo en general dentro del personal, dentro de la clínica, de mejoras en la atención.
And so Clinica Leticia is the latest in a line of examples of centers that have been established for the long-term benefit of the region. Medical Ministry International has really focused our mission statement on using Jesus as our guide, because our focus is to serve the people and to treat people the way Jesus would have us treat them.
If we were addressing healthcare only on the physical level, then I think we are shortchanging what we're offering to communities and to people who are coming to us for healthcare. If we neglect the spiritual, we are not addressing the total health needs of a person.
You cannot pay the feeling of satisfaction when you see that smile. People with no means to be able to get a surgery being performed, and then suddenly a gift is given to them.
I want to say thank you so much. Thank you so much. This is a miracle.
This is an incredibly exciting time at MMI.
As our ministry grows more and more by way of permanent centers, the financial needs will grow exponentially, and it's going to take a lot of committed people and a lot of money.
We need to focus on trying to go out there and do everything we can to try to save that next person that basically will die without our help. There are many people out there that will never have the opportunity to actually join one of our teams, but they do have the ability to help make this work possible. Victory for us is to see that child that last year was totally blind because of 2 congenital cataracts. This year, she comes back and she has a follow-up, and her mother is telling us how she's interacting with her friends and able to see and go to school like any normal child. That is victory for our team.